Welcome to our growing community of 21st century global seekers, seeking to be educated and delighted at the cutting edge. Hello to people all over the US and 103 countries who have registered for the series. Thank you all for tuning in. We're offering our new free series in order to build an online global community focused on brain health. We'd like to thank Lugano Diamonds for their generous support as our national underwriter. We thank Lugano Diamonds for choosing Aspen Brain Institute as a nonprofit worthy of their support and their values, and for making our Zoom expert series free to the public and able to be viewed worldwide. We also thank Alpine Bank for their generous sponsorship over many years now. And we thank our partners at Brain Futures who are doing important work in advancing the practical application of new scientific understanding of the brain and learning. At our Expert Series 2.0, you will hear global leaders, deep thinkers, technology experts, cutting edge scientists, top-notch doctors, and extraordinary creatives. We hope their insights will transform how you care for your brain today in a way that your 80-year-old brain will thank you for tomorrow. We at Aspen Brain Institute are on a mission. Our mission is to create a brain healthy planet by sharing access to the top minds and evidence-based research on brain health, and by increasing brain health literacy worldwide. It is my honor and privilege to bring to you these new episodes. Let's see what we can learn and explore together. And now to our expert series. First, I want to introduce you to our moderator for today, Emily Gold Mears. Emily, trained as a lawyer, is an esteemed member of the Aspen Brain Institute Board of Directors and is now directing her passion for innovative medical and science research into finishing her first book, which is called The Science of Optimal Health and High Performance, coming out soon in the next year. This is going to be a fascinating discussion. Emily, take it away.
Thank you, Glenda.
You're welcome.
So I would like to introduce you to Rachel Yehuda, our speaker today. She's the director of the Center for the Study of Psychedelic Psychotherapy and Trauma, vice chair for Veteran Affairs for the Psychiatry Department, and a professor of psychiatry and neuroscience at the Icahn School of Medicine at Mount Sinai, as well as the director of mental health at the Bronx Veterans Affairs Medical Center and the director of the Traumatic Stress Studies Division. Throughout her career, her research has focused on the study of the enduring effects of trauma exposure, particularly PTSD, as well as associations between biological and psychological measures. She has investigated novel treatment approaches for PTSD and the biological factors that may contribute to differing treatment outcomes for the purpose of developing personalized medicine strategies for treatment matching in PTSD. She has authored more than 450 published papers, chapters, and books in the field of trauma and resilience, focusing on topics such as PTSD prevention and treatment, molecular biomarkers of stress, vulnerability, and resilience, and intergenerational effects of trauma and PTSD. I hope you'll agree that she is the definitive expert in many aspects of PTSD. I'm excited to have her with us today. It is my honor to introduce all of you to Dr. Yehuda.
Well, thank you very much for that introduction. If anyone would have told me even 2 years ago that I would be speaking about psychedelics at the Aspen Brain Institute, I would have had a laugh, because I do generally get asked to talk about things like epigenetics and intergenerational effects of trauma, the biology and treatment of PTSD, and similar work, like you just mentioned, that we've done in the field of trauma. But in the last year, I've joined a growing group of researchers around the world who are examining the potential therapeutic effects of psychedelics in mental health for conditions like PTSD and depression, anxiety, and substance abuse. And today I'd like to share my perspective about the pivotal opportunity that psychedelics present for patients with mental health conditions and for scientists who are seeking to understand the underlying mechanisms of recovery and resilience. I'm excited about the potential for psychedelics, not only because so many of our patients stand to benefit from them, but because their very adoption stands to revolutionize how mental health is conceptualized and delivered. And I think we need a revolution in mental health care. What we currently do for patients with the conditions that I just mentioned is pretty much try to keep them in treatment for as long as possible. We often prescribe daily medications that are taken for years and sometimes even decades, even though these medications can have side effects like sexual dysfunction and weight gain. We offer psychotherapy in hourly increments, weekly, monthly, or as needed during a time of crisis. Many times the psychiatrist prescribing the medicine isn't the same person as is doing the psychotherapy. But most important is that we try to make sure that our patients don't get worse or that they don't fall off of our radar. But it is a fact that current treatments leave at least a third of our patients with severe symptoms and very rarely result in remission. And this might be why we're so satisfied with small incremental improvements, but the escalating rate of suicide in our country suggests that there is a profound inability to deliver, at least for many people, the kind of treatments that they need and that they deserve. But psychedelics offer a novel model of treatment that might lead to large improvements in a relatively short period of time. Psychedelic drugs promote a change in a normal state of consciousness, often by heightening the senses, and this causes people to experience themselves in the world differently. And the psychologist Stanislav Grof said about psychedelics that when used responsibly, they can be to the field of psychiatry what the microscope is for biology or the telescope is for astronomy. And I think that's a really good description because in the altered state produced by psychedelics, people can see things that perhaps they would not otherwise see. And once those things are seen, it isn't necessary to keep taking the psychedelic. As the philosopher Alan Watts put it, if you get the message, you can hang up the phone. The biologist doesn't work with their eye glued to the microscope. She goes away and works with what she has seen. So it is this work of understanding and integrating the psychedelic experience that leads people to make really big changes in their lives. And these changes can result in dramatic improvements in their symptoms. Now, you might be listening to this, if you are listening to this, and you think, this sounds too good to be true. There's no quick remedy for mental health conditions, particularly chronic ones, then you are having the exact same reaction that I had when I first heard about psychedelic-assisted psychotherapy. So I want to share with you how I went from skeptic to participant in really this global renaissance of psychedelic research. And I think that this is a really important conversation because there's still so many people, clinicians, important policymakers in mental health that are still concerned about the use of psychedelics. And the reason that I know this is because I'm running into so many of them as I try to pursue this work. A lot of the concern is the result of the lingering effects of government policies that were instituted in the late 60s and 70s that are long overdue for re-examination. These policies were made without considering the therapeutic legacy of psychedelics, and there is a legacy. Prior to the 60s, psychedelic drugs like LSD were being studied in mental health for their potential effects in accelerating gains in therapy. These studies were funded by the government. MDMA was used by hundreds of therapists to help patients feel more open and promote greater self-awareness. And for thousands of years before that, Psychedelic medicines extracted from plants like mescaline and ayahuasca and psilocybin had been used by shamans in indigenous cultures as part of healing rituals and spiritual journeying. But in the 60s, the government began designating psychedelics as having high risk for harm with no medical benefit. And today we call this a Schedule 1 classification. And after that, the government stopped funding research into the potential effectiveness of psychedelics as therapeutic agents. With a little more time, there might have been compelling evidence for the efficacy of psychedelics to support a less restrictive category, like a Schedule 2 that is used for opiates and amphetamines, which are not illegal drugs, but simply restricted. But there were political considerations that made it seem like an emergency for the government to take quick action. And we see this even today. Sometimes political considerations, I guess, trump scientific data. Psychedelics were made illegal because the establishment saw a connection between the recreational use of psychedelics and the counterculture's rejection of their values, and particularly as expressed by the anti-Vietnam War protests. And the establishment absolutely had a point, because it's hard to think about violence and going to war after you undergo an experience that fosters love and connection to others, to nature, and to the universe. Although the government stopped funding clinical research examining the usefulness of psychedelics, it did start funding science on the negative consequences of psychedelics when abused or when given to animals in extremely high doses. And this led to a really big concern in the scientific community that psychedelics may have neurotoxic effects, particularly with respect to serotonin brain neurons. I remember a commercial that aired frequently when I was growing up. It showed an egg. This is your brain. Then the egg was cracked and put in a sizzling frying pan. This is your brain on drugs. And the message was really clear and really effective. And most of us didn't even realize that it was based on oversimplified and sensationalized interpretations of the science, because the message was so perfect. The effects of this message are still with many of us today, because today, if you Google the term psychedelic drug, mainstream authoritative dictionaries like Webster or Oxford or Britannica will define these drugs as drugs that produce psychotic states or perceptual distortions and hallucinations, or altered perception but with diminished control over what is being experienced. And these definitions are scary, and they perpetuate negative ideas about psychedelics in mainstream psychiatry, in medicine, and in the general public. Because let's face it, many people think that if these drugs are illegal, there must be a reason.
Hey, Dr. Yehuda, it's Steve Tucker, producer. We're getting some comments from a few folks that it's kind of hard to hear you. If you could move closer to the microphone, I think that would be helpful. I hate to chime in, but I thought it was best to do that and make sure that everybody could hear you okay.
Thank you.
Much better, thank you.
But the narrative that psychedelics are many people think that if these drugs are illegal, there must be a reason. But the narrative that psychedelics are dangerous results from a failure to distinguish between the effects of a trusted compound used in the hands of a trained therapist in the context of a therapeutic process, and adverse effects that can occur when a drug is used in an unmonitored setting and at the wrong dose, not to mention that perhaps the drug causing the negative reaction isn't even the drug you think it is, because it is cut with something that is dangerous. But it is the failure to make that distinction that has deprived mental health patients of potential solutions. But the good news is that things seem to be changing now. The FDA has designated 2 breakthrough treatments, MDMA-assisted psychotherapy and psilocybin for depression. And this means that pending the results of phase 3 trials, the FDA could approve these treatments for clinical use. Now, the government is still not funding clinical trials of psychedelics or any science supporting its use. So far, funding for this work has come from private philanthropists and investors. And they're important heroes in this story because this work has now resulted in a very different feeling as people like myself start to realize that we've been laboring under some really bad assumptions about psychedelic use. And indeed, I am often still asked, what is driving me, a person who has been so rooted in mainstream academic psychiatry research and conservative healthcare systems, to do research in these compounds? And I'll answer that now. At least a part of that story has to do with the fact that about a decade ago, I became progressively concerned that the field of trauma had headed into a dead end with respect to PTSD treatment. PTSD is a very serious problem and develops following trauma in about 10% of people, with a higher prevalence among people who have actually been exposed to trauma. So there's a 30% rate among combat veterans, and a nearly 50% of rape victims have PTSD. And the most common thing that I've heard people with PTSD say is that I'm not the same person that I used to be. And indeed, PTSD really changes the way that you look at the world and yourself. People with PTSD are haunted by memories of what happened and by nightmares. Traumatic memories bring back the fear and the helplessness and the horror and a lot of the fight or flight that was experienced when the trauma was happening. And this causes trauma survivors to really try to avoid any reminders of the trauma. And they often restrict their lives and become emotionally numb, certainly to positive emotions. They see the potential for danger everywhere and are constantly on alert, kind of like on survival mode, and they can't sleep or concentrate. Now, PTSD patients do experience emotions. They experience extreme anger and shame and guilt. And after a while, this kind of negative view of themselves in the world becomes an immutable narrative, and they just get stuck in it. As an academic, I do a lot of speaking and teaching, but a few years ago, I just couldn't steel myself to give talks about treating PTSD, and I found myself less than willing to tout evidence-based gold standard therapies because I felt that their effects were minimal and also not long-lasting. And I really wanted to call my field to arms and get my colleagues to acknowledge that our current approaches weren't providing the kind of healing that our patients really needed. And by this time, I had had many leadership roles, developing treatment programs for PTSD at the VA and for civilians at Mount Sinai, including clinics for very traumatized groups like Holocaust survivors and 9/11 survivors and victims of childhood abuse. My team had conducted numerous clinical trials examining the efficacy of various PTSD treatments, including experimental ones. Our group had also developed state-of-the-art biomarkers to try to examine mechanisms of recovery by looking at brain images and epigenetics and hormones and neurochemicals. And we were poised to examine biologic mechanisms of resilience following treatment. But it was difficult to identify them because even the gold standard treatments in PTSD weren't powerful enough to generate enough people that could tolerate the treatment or achieve the kind of recovery that we needed. So we were, in a way, all dressed up with wonderful scientific technology and methods, but nowhere to go in terms of the kind of treatment signal that would help us identify the biologic changes that occur when people with PTSD actually get better. Now, many professionals will tell you that PTSD is one of the hardest mental health conditions to treat. Conventional medicines, even the FDA-approved antidepressants, they don't fully work because they just blunt symptoms. But healing from trauma involves confronting what happens. But there's a big catch-22 here. Talking about the trauma, even with a therapist, can often be re-traumatizing. And that's why many PTSD patients will avoid talking about the trauma, even with their therapist. And many of them will avoid coming to therapy, and some will drop out. Now, the prevailing idea is that if you can get someone to become desensitized to their own narrative by having them repeat over and over again what happened, they won't be as reactivated by the memory of their past experiences. And this is sometimes called habituation or fear extinction. And people in my field talk about this a lot. Now, this kind of approach, it can work, particularly in people who are able and willing to fully disclose details of what happened to them without hiding important aspects of it from the therapist or for themselves. Conventional PTSD treatments can also work if there aren't a lot of complicating other factors like suicide behavior or brain injury or substance abuse or ongoing stressors, but many patients have those things. Cognitive behavioral treatments will work less well in the context of multiple or chronic trauma, or what we call complex trauma, or when the trauma is not that well defined, or if it created a moral conflict, such as in the situation of combat, when one is the hunter and the hunted. Some traumas are just confusing because they're a composite of bad things that happen, but also good ones. Combat experiences can be brutal, and some decisions that were made agonizing, but there's also camaraderie and patriotism and service and many positive accomplishments. It's the worst of times, but sometimes it's also the best of times. And with repeated sexual abuse in childhood, the victim often receives love and attention along with the abuse. Trauma is so much more complicated and multifaceted than it seems. And it's often ineffable, which is a word used to describe psychedelic journeys. Some say that trauma is unspeakable, but without words to describe the trauma, conventional therapies will fall short. When people do heal from trauma, it's often because they figure out how to construct a new narrative about what happened to them and what it means. They see things in a different light. This occurs when the trauma survivor can reflect on the trauma without being flooded by the usual feelings of fear, shame, guilt, and self-recrimination that can really obscure their own understanding of their experience. And also if the fight or flight response can be quieted down a little bit. In PTSD, there are brain changes that can ramp up the body's resistance to confronting the trauma and changing perspective. Psychedelic-assisted psychotherapy for PTSD can actually really help with these particular problems because the psychedelic allows people to mute the normal self-critical voice inside their head. It also helps get them out of survival mode. And that allows people to peer inside that microscope and get a very different perspective and see their trauma differently. I think that MDMA is particularly helpful in PTSD for 3 reasons. MDMA promotes feelings of empathy, self-compassion, and connection to others, emotions that are generally unavailable to the PTSD patient. MDMA seems to make unpleasant memories less disturbing by suppressing activity in the amygdala or fear centers in the brain. And since the amygdala has been found to be overactive in trauma survivors who are reliving a traumatic memory, this feature of MDMA may be a very important reason why this works during a session. MDMA also increases introspection and trust, though, and this allows patients to really work with their therapists doing trauma-focused therapy. And studies have shown that after 3 sessions of MDMA and about 9 short or 90-minute integration sessions, patients who have tried and failed other treatment methods will show an average decline of 50 points on a PTSD severity scale. And I want to really give you an understanding of how to put that in perspective. Cognitive behavioral therapy trials will deem a patient to have had a clinically meaningful response with just a 12-point decline in symptoms over the kind of the same period of time. And since most patients start out with a score of like 70 or 80, a 12-point decline doesn't actually make a huge difference in their lives, even if it can yield a statistically significant change in symptoms. But a 50-point decline, that is a game changer. And even months after the treatment is finished, 2/3 of patients no longer have PTSD. They seem happy with their lives and their relationships. The one thing that people who experience trauma know is that the world can change very quickly. We all know that now because we have lived through a global pandemic. But the fact that things can change quickly can be harnessed to an advantage. Because just as the experience of trauma can be a watershed that so quickly shatters and negatively impacts someone's life, psychedelic assisted psychotherapy can yield a defining corrective experience that is no less consequential and capable of eliciting a reorganized narrative about oneself that can actually lead to a very big change. There's still a lot of work to do in this very new field of psychedelic psychotherapy. And I'm going to mention three of the things that I think are really important. First, I think it's important to examine psychedelic medicines in the most vulnerable populations, in traditional healthcare settings, in community settings, and in VAs. But while we're doing that, it's important to think about the kind of therapeutic environment that we may need to create that will allow people to derive the full benefit of psychedelics. People talk a lot about the importance of set and setting when they talk about psychedelics. Set is the intention, the difference between a recreational intention, for example, and a therapeutic intention, which we talked about earlier. But setting refers to where you are physically taking the drug and with whom. So taking it with a therapist, that's good, but what is your environment like? Is it cozy? Does it have pretty things to look at? Is it in nature? Is it with music? And I think we're going to really have to think about our clinical environments and whether they're conducive to the kind of work that we need to do with psychedelics to achieve healing. I think the second really important thing is that we're going to have to start thinking about how we're going to train the next generation of mental health providers so that they can work with psychedelics in their practice, and how we're going to introduce this kind of work in medical schools and in residencies, and how we're going to create fellowships, how we're going to teach this in psychology programs and postdoctoral fellowships in psychology. Finally, it's critical to apply the scientific tools that we've worked so hard to develop over the last few years towards an understanding of a science, towards a new science that will help us understand mechanisms of recovery with psychedelic drugs. Because in order to revolutionize mental health, we need to replace the science of what can go wrong when psychedelics are used inappropriately with what goes right when they're used therapeutically. Look, medical science can be very slow to accept even FDA-approved treatments without understanding how they work, what are their biologic targets, and what are their mechanisms of action. And the important science here may not even be the pharmacology or what happens to your brain while under the influence of psychedelic drugs, but rather the science of how critical brain networks and epigenetic programs become transformed and reorganized by the experience of psychedelic psychotherapy. Really, it's the science of integration that we need to study. It's the science of it's the science that will really help us explain how a single event, psychedelic psychotherapy, galvanizes a process of healing and post-traumatic growth. But in a sense, this is so similar to the predicament that our field was in when we had to start figuring out how a traumatic experience, something that happened well in the past, could continue to catalyze a process that resulted in chronic PTSD symptoms. And we had to get away from the idea that the answers would be in the fight or flight response and go for very different mechanisms that really explained how a single experience initiates a longer cascade of epigenetic effects that result in a more profound and enduring change. So it's really a very similar question that is being asked from a different angle. So I've made a commitment to psychedelic research. I actually think it's a moral imperative to consider anything that will bring healing to people who need it. And I think we're so well poised to understand the neuroscience behind it. And understanding this neuroscience, I think, will allow psychedelics to be ratified and institutionalized in mainstream healthcare and society even more quickly. I also actually consider it a privilege to be here now at this moment, when it looks like things can really start changing for people who suffer from trauma and other mental health conditions. Thank you.
Thank you so much for that, Dr. Yehuda. That was so interesting. And I have many, many questions, as I'm sure our audience has. I wanted to start with, I feel as though I would be remiss if I didn't bring up the year 2020, because I recall reading in your research, you state that cataclysmic events trigger trauma. And I think we all agree that 2020, with the pandemic, with the global economic downturn, with the civil unrest, all occurring at the same time, certainly amount to at least one cataclysmic event, if not several. And I'm wondering what your insight is on the long-term mental health consequences of people today and subsequent generations.
Well, that's a really very interesting and good question. And I think that we have to worry about the effects of trauma on our population today, so that we can prevent this having an impact in subsequent generations. I think that that's really key. So we have to provide mental health now to people who are suffering, and we have to give people hope that they have the tools to be able to get through what is really a difficult period. I think a lot of times it's the helplessness that leads to trauma-related responses. And so by developing resilience-enhancing tools, we might be able to prevent a spread of this particular the mental health effects of this pandemic going forward. We really need a recovery.
Hopefully that is true. You talk about the mechanisms of healing, in particular suppressing the amygdala, which is overactivated in patients with PTSD. I'm wondering how the treatment affects both the prefrontal cortex as well as the hippocampus, where we store memories. Are good memories altered along with the bad memories?
So research using psychedelics is just getting started, and I don't think too many people have looked at the effects of psychedelics on brain function in people with PTSD. And that's an important thing to be able to do. I think there's just been one initial study in that area. So I think that's going to be an important frontier to see whether or not the psychedelic is actually going to have an impact on memory. But I just want to clarify that the amygdala is overactivated, not always and all the time in people with PTSD, but particularly in the context of them remembering and re-experiencing their traumatic memory. So I think the more we can get people to kind of focus on more positive healing experiences, maybe we can turn that around as well. Because when people see that they can suppress their amygdala, then they don't feel as stuck in this idea that they can't do anything to prevent their internal state. So a healing experience that actually allows them to dampen it down for a little while can be extremely, extremely eye-opening for them.
I see. Okay. I'm wondering, are there any positive adaptations from experiencing overwhelming stress? For instance, one may respond by increasing their resiliency and their ability to deal with adversity that may not be present in those who never experience stressful situations.
Oh, I am a total believer in that. And I think that one of the things, you don't need to have a psychedelic experience to have post-traumatic growth. I think that it really helps catalyze the process. It can take a very long time for a trauma survivor to sort of reach a perspective that as a result of their trauma experience, this just puts them in a position to do things that they would not have otherwise done. Sometimes I call this being the podium of suffering. People who have experienced extreme trauma are in an unparalleled position to help other people who are similarly going through that trauma, or to understand what might be helpful for them. Many trauma survivors turn their PTSD around, and even alongside with their PTSD, really seek to make things better for other people. And this could be a very important part of their healing. I think that resilience is something that you come to have after you've been traumatized. It's not a muscle that you need until you're really challenged. So I think the experience of going through a really dark time can be very, very transformative. And people who have come out the other end will say this. I've heard it many, many times. And there are so many examples of ways that people begin to feel better, begin to feel like they can reclaim their lives, that they don't have to continually worry about being harmed, can, you know, turn that around and help other people.
Interesting. Okay, what about the unintended consequences of this treatment? It seems as though our biology is so very complex. And I wonder if we begin manipulating certain aspects, like our neurotransmitters, how are we affecting the rest of our biology? For example, if MDMA boosts serotonin, is it possible that we may inadvertently thwart our endogenous production of this and other MDMA-affected neurotransmitters and then become dependent upon this treatment for the production of these vital neurotransmitters?
Sure, you could be asking that question about antidepressant drugs in general, selective serotonin reuptake inhibitors that are taken daily for years, sometimes for even longer than that. MDMA is short acting. Half-life is about 7 hours. So it is true that there might be serotonin depletion. There's a very big rush of serotonin as a result of taking MDMA. But the therapeutic use of MDMA really involves taking it once, doing several integration sessions, maybe several weeks later taking it again, doing a few more integration sessions over the following weeks, then taking it a third time. And this would be over a 3-month period. And that's it. That's pretty much a course of treatment that is recommended. So it doesn't have with it the same kind of toxicology profile or concern of permanently depleting serotonin. And again, that's some of the problems with the over-sensationalized view of this is your brain on drugs, is that yes, you can take an fMRI or a PET scan, and somebody who is either you or somebody who has recently used drugs or is using them now can look like a lot of things light up. And our response to that can be, ooh, look at this, something great must be happening. Or it could be, oh my goodness, something terrible is happening. But it's temporary. And so that is really the key. The key is whether or not there's going to be permanent or chronic or long-term damage. And, you know, there hasn't been any evidence to suggest that when psychedelics are taken therapeutically, there is evidence of this kind of damage or neurotoxicity or problems. So again, any compound that we take can be dangerous if it's not taken in the right way. This is a fact. This is why so many of our compounds are prescribed by people that are knowledgeable. And that's really one of the very important challenges of medicine, that you have to be in a position to understand drug interactions and so many other variables. But even benign things that we can buy, like aspirin, can be dangerous to us if we don't take them the right way. Psychedelics, from what I have come to learn in my short time in the field, actually seem like some of the more safer types of medications compared to some other ones that you really have to worry about. Again, sometimes the field makes mistakes in not thinking something is dangerous when it is, or thinking something is dangerous when it's not. But we need to keep an open mind and continue to revisit the data so that we get this right. It's really important.
Interesting. So you talk about the long-term potential consequences of toxicity. Toxicity is unknown. What about the long-term positive effects? You talk about 3 different treatments. how long have you been tracking the participants to determine how long the beneficial effects last?
Just to be very clear, we haven't done any of these studies yet. I am referring to data that have been sponsored by MAPS in connection with their phase 2 trials. And so this is in the literature. And in terms of their follow-ups, it seems that patients that have been treated with MDMA not only remain with their gains in terms of their symptom improvement, but many of them continue to process traumatic memories thereafter. The process of integration keeps going on because, again, once you see something in a different way, your mind will start to make many connections and you'll set yourself off on a path of healing. Especially if you have a therapist to discuss it with, and even some people leave therapy but are still continuously thinking about and making treatment gains, because it's not a medication effect. It's an effect about changing your mind about something. The psychedelic helped put you in a state where you could see something that you would not have otherwise seen. That's why I think that analogy to a microscope in biology or a telescope in astronomy is so good. You really have to see it and then work with it. But once you know something, you know it. You're not depending on a medication to change your state. You are changing your knowledge base. And that is really what I think the revolution here is, that you change a state to help a process along because someone has been stuck. And this helps unstick them potentially. And this is what's going to lead to the treatment gain. And that's why I think it's going to be a revolution. Because a lot of times we think about mental disorders like we think about diabetes, just take that insulin when you need it. It's a chronic condition and you're going to, or a hormone replacement because we have to make sure your brain chemistry is leveled off. This is a different model than that. Maybe in some conditions where the problem is that the brain chemistry needs to be leveled off, maybe the conventional treatments work. But for trauma, I think the problem is people are stuck in a narrative about themselves and the world that is just feeding back in this loop of more avoidance and more being overstimulated, more kind of worried about bad things happening, recriminations, feeling bad about themselves, feeling that they need to restrict themselves from other people. And that is a cognitive process. So they were right in terms of cognitive behavioral therapy being the right idea. That's correct. The theory is correct. But in practice, it's just hard to do because there's so much going on and traumas are so complicated. And the process of just asking somebody to talk about their trauma without giving them a look into a microscope imposes a lot. Not everyone can do it. So for those people who have tried and failed it, this is something new and something different.
I see. Well, thank you for explaining that. I'm going to ask you just one more of my own question before I turn to the audience questions. And my question is about how you discussed that we're in the midst of this revolution for mental health care treatment, which sounds terrific. But it seems though one of the many steps that will be involved in having that revolution succeed is to really change the minds and transmit new information surrounding this. And I'm wondering if it seems as though one very effective way to do so is to share compelling personal stories. And I don't know if the MAPS organization, because I know so little about them, if they are going to embark on documenting or chronicling individual personal stories of success to help change the minds of people whose minds need to be changed in order to facilitate this forward.
I'm sure that many people who have undergone this experience want to tell their story, but what I'm up to is just the need to continue right now to do this work. I think that it is very important to do clinical trials and try to reach people who have given up hope in terms of therapy. For me right now, it's about science and about doing really rigorous clinical trials that also give us some insight into what might be happening, because there might be a different way, there might be a shortcut way, there might be a scalable way, there might be a way of working a little bit different than the initial experiences that people are having with these compounds. So I think that I'm really interested in seeing how generalizable this is, whether it works in lots of different treatment settings, whether people can continue to show these strong and remarkable effects. And yeah, I think that there are many people who have talked about their personal experiences, and documentaries are out there. And I think that I've spoken to some of the people from the MAPS trials, and it has been unbelievably evocative and exciting that people that were stuck are now in a very, very different place. But I think we have to keep going, because sometimes we're very quick to think something's a done deal when we're just at the beginning of it. And that's what I think. I think that getting the green light, from the FDA to approve these medicines so that we can really be able to understand how to use them is a very, very, very important first milestone.
And actually, I said I was going to go to the audience question, but I have one more, because you just triggered a question. I'm wondering if this MDMA, is it in the public domain? Does Big Pharma have any financial incentive to make money on this so that they can help with the legalization and the promoting of this?
Yeah, that's not exactly something that that's sort of not my table. I'm sure that there is a strategy pending FDA approval. I've tried to focus on really the science and why this is a good fit for people with PTSD. I believe the MAPS, I think that it's okay for people to think about making money on treatments that work. I think that stimulating interest in psychedelics, however it is achieved, is very important right now. But I don't really know all the things that are coming down the pike on that.
Okay, so here's a question from our audience. Could you please lend some insight on the role of benefits of microdosing, taking a fractional amount of psilocybin? I mean, I don't know if that's your area of expertise. It seems like MDMA has both a different outcome and effect on the brain. But this person is asking 1 day on, 1 day off, 3 days on, 1 day off. The research seems limited, but the anecdotal evidence suggests this may also have promising benefits.
I think that the really important part of that question is that there are so many things that we only know anecdotally. And when these drugs become legal, and even right now with FDA approved clinical trials, we can and should be asking these questions. So any question that you get that is in the vein of something that hasn't been formally studied, because people have had their own experience and they're wondering about things like microdosing, or they're wondering about combining psychedelics, that's not in the literature yet. That's not available for us to know in terms of the channels that research takes. And so all of those things are really, really important to investigate scientifically. So I'm always fascinated when people tell me about their personal experience, because I think to myself, how to convert this into a research protocol so that it isn't just an anecdote, so that it is verifiable scientific evidence-based fact that can then be shared with confidence to a broader population. That's the responsible thing for someone like me to do.
I see. So I have one more question, one more audience question before I'm going to turn it back to Glenda to wrap up the presentation. And that has to do with the fact, since traditional drug development has not seemed to work well for mental health, and this seems to have such promise, I suspect that there are a lot of underground therapists who are conducting these treatments. And I'm wondering how people who are anxious to try this are able to discern between a well-meaning, able underground therapist and a charlatan.
That's the problem with having treatments that are underground. It's not, the better solution would be to train mental health providers appropriately to credentialing and allow these treatments to become available in a very responsible way with the oversight that is needed so that they can take them. Until then, the second best option would be to look for a clinical trial that is studying the psychedelic that you're interested in having. I know that there is an underground network, but I don't know how to answer that question of how would you know, because that's exactly what the problem is. The problem is that people like me want to do the research that will help make this above board, not underground, so that we can really bring everything we can to people without having to worry about charlatans or people that don't have the appropriate level of training just in psychiatry and psychology that might be needed to handle mental health consequences.
I see. Well, before I hand everything back to Glenda, I just wanted to thank you so much for your fascinating presentation and for your research and your contribution to the area of mental health.
Thank you very much.
Thank you both. I'm coming back in and want to thank you, our outstanding expert, Dr. Rachel Yehuda. Thank you so much. I think your work is revolutionary, and I think it's going to be accepted and lauded, and we all look so forward to hearing more about it. And Emily, thank you for being a great moderator, great questions. And thanks to our audience for getting educated and updated on some of the new aspects of the new science of brain health. And thank you again to our sponsors, Lugano Diamonds and Alpine Bank, and our friends at Brain Futures and the American Federation for Research on Aging. Now, this episode was our last and final episode of the 9-week Expert Series 2.0. So I want to close this expert series with some exciting news. With the success of our past 17 episodes of Expert Series, been so successful and somewhat all over the world, at least globally for us from 103 countries, we decided that we would create a new series. And this one is a new 5-part brain healthy cooking series. And it's our holiday gift to our global brain healthy community. And it will air the first one on November 10th and weekly thereafter for 5 weeks. You can look at our website, aspenbraininstitute.org, for full details. And please check the website to sign up for the first episode. And you can also sign up for all 5 episodes at the same time on the website. So it's my pleasure. I hope we will see you all again on November 10th. Thank you to our experts today. It was a great discussion. And ciao, everyone. Take care.